Uh-oh. 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 We are live, Charles.
Okay. Aloha, everybody. How you guys doing right now on a
Woo!
Monday?
What a day.
18th. Aloha, no, everybody. Good to see you. Good to see you, boy.
And we can see them too. We can see each and every
Yeah.
one of you. So make sure you guys
Yep.
are all presentable. How was your day, Charles?
Well, a lot of posting, a lot of disagreements, but it's all about running to open. And I said, yeah, open. But, in fact, a lot of guys, they grumbling about the opening because we're almost there. How they only get hotels left, if you think about it, get hotels left. And you know, and the hotels are the ones saying they don't like open until the quarantine is lifted, and they know the importance of a quarantine. So you cannot argue with that. But some people say they want the freedom. Hey, I agree with you. Have the freedom. But at the same token, please don't come in my space. I don't make it known if I don't know you. I just like because I wouldn't do that to you. But other than that, but we can agree to disagree. That's a good thing about it. It was civil. It was civil. But then,
For the most
yep,
part, I think most people are courteous. Most people are professional. Most people are,
yep,
share the aloha spirit.
yep,
But every
exactly.
so often, get some doodle boys out there
Yep.
that like flex their muscle on behind the keyboard. But it is what it is.
Yes.
Anyway, what a show tonight! What a show tonight! Anyway, thank you guys for joining us tonight. Last night we took a little break, and sorry for those of you that jumped on and found that we weren't there. I should have posted that post earlier. Apologize. We just wanted to
Yeah.
relax. Probably gonna take Sundays off. A lot of you came back and said, "Hey, you guys should take Sundays off." Yeah, I think so. But anyway, we're back tonight. We got Dr. Scott Miscovich back, and I got some of your questions already from the messengers. Hair salon still not open. No, not yet. It's kind of confusing because the governor said one thing in his press conference, his proclamation doesn't specify an open date. I think we wait and see what the mayor says. It'll be soon though. It'll be soon. Let me see. Doodle Boy shirts. We're gonna talk about that in a little bit once everybody is on because we have reached our goal, Charlie. We have surpassed the $5,000 mark, and thank you all for buying those shirts and flashing them on Facebook and so we're going to be presenting a check very shortly to Hawaii Community Foundation once we get everything settled and done. And then I did want to say a special mahalo to Sandy Howitt. She offered to donate $1,000 if I shaved my head. $1,000 if I shaved my head. So we're trying to get through the logistics, and she messaged me yesterday, and she says, you know what, you can keep your hair. I'm gonna donate $1,000 anyway. So we got $1,000 from Sandy Howitt. Thank you so much. That will go to the Kauai Strong Fund at Hawaii Community Foundation. I get to keep my hair, and well over $5,000 on the shirt. So we'll be making a nice contribution. Thanks to all of you for purchasing the shirts. Now the shirts aren't going to go away. You still can get these shirts, but the shirts now we have set up a website, and you'll be able to get it from there. I'll post the link up in a little bit. Once we get moving and we get more people on, definitely want to patronize Island Athletic Tees. That's Kirk Correa. So this is what it's going to look like right here. You guys will get to see it. You can get the original, the Doodle Boy, and he is going to be making an Okole Puka shirt, and that will be available very shortly. So I will post this link up, and you will be able to pick up your shirts straight from Kirk, and he will take care of everything for you guys. So again, thank you all for your generosity and sharing with everyone your shirts and amazing, amazing, amazing. And Hawaii Community Foundation is very appreciative. So with that, go ahead and share this broadcast because Scott Miscovich, Dr. Miscovich is going to answer a lot of questions. Go ahead and hit the share button, start a watch party, do whatever you got to do to get this thing out because I cannot wait to hear what he's got to say. There's a lot of developments, Charles, since he was on last.
Yes, a lot. You know, a lot of it has to do with, you know, I really want to find out from him, but I'll save my question. But I'm gonna ask him a big question, not to go against it, not to go against the grain, but I just want his honest opinion. I think, you know, he's always been a upfront guy. So,
oh yeah, absolutely.
Can't wait to talk to him.
All right. Well, where did he go? Where did he go? There he is. Boom. He's coming on. He's on somewhere. There he is. There he is. And he's sideways. He's sideways. Okay, now you're straight. Can you turn your phone the other way, sir? Can you turn it? Can you turn your phone? There we go. And turn on your audio. There you go. Earthquake, earthquake. Cannot hear you. This happened the last time too.
Yeah.
You got me?
Gotcha.
I got you now. Welcome back, Dr. Miscovich.
Nice to be back, guys. Always good to be here.
Busy guy, man. We see you all over the place on the news and in commercials and everywhere, man. Awesome.
Well, I'm trying, and we're not giving up. And I have a great team around me, and you know, we're really happy where we are right now. I think as a state, we should be happy. And I think in general, we're all very happy that we started. Actually, remember last time we talked, we were just fighting the battle to get the testing done. And we really never gave up. And, you know, I think that we feel good. We went out and we taught a lot of other people how to do the drive-through testing. And here we are sitting right now where we have flattened the curve as a state. We knew we could do it, and we have done it.
Well, thank you very much, Doc, for your persistence, your never-ending drive and perseverance to get this thing done. I know, I mean, there's a lot of people. It takes a lot of people to get where we are today, but it didn't come without a little bit of struggle. So we just want to welcome you back. A lot of things have changed. And maybe we can start with that, Doc. Just give us an overview of where we at, where we came from, what's coming up front. And then we do have some questions that have been coming in, and there'll be a lot of questions, I'm sure, from the viewers tonight. So,
sure, yeah. Well, where we are right now is, as everybody sees. I mean, look at where you guys are in Kauai. It is just incredible. We basically don't have any positives for quite a long time. I mean, look, we have 0 positives on Oahu. And, you know, just one pops up here or there. We had the little cluster over at the public housing here on Oahu. So in general, what we feel is there's a very, very, very low burden of the disease, a low prevalence of active disease on the island. And I've said this before, and I'll say it again. This is a credit to the people of Hawaii. That's how this happened. This happened by virtue of the people listening, the people basically following quarantine, the people following social distance, using their masks, and actually doing what they were supposed to do. So that is who everybody deserves credit. And then where were we? Well, we were at a point where we were going to have a crisis if we didn't start testing, because we all know, as the private medical personnel know, that testing was the answer. Testing was the thing that showed South Korea, Taiwan, Singapore, some of the countries that have done well. They tested, they tracked, and they followed, they quarantined, and they did it again and again. Well, we did it. We did it as a state, and it went really, really well. And again, I give credit to the people of Hawaii. So, right now we're in good position. We're in good position to be moving forward to what I know we're going to spend a lot of time talking about tonight, which is how do we stay this way? How do we keep our state open? How do we keep our people healthy? How do we get our economy back on track without sacrificing? There are so many questions that need to be answered now by everyone in the state, but the health professionals all have to step up to protect the people we love, our families, our patients, everyone. So I could get into a heck of a lot of specifics, but I know you guys are going to nail me with all that. So I'll let you go.
Well, I think, one of the things that I did want to talk about, and I'm not sure at what point, but we can do it right now, is that cluster at the public housing. There was some, I'm not sure what it was, but I was watching the press conference when the media asked the governor about that cluster, and he didn't know anything about it. And of course, Bruce Anderson came up and mentioned it, but it had happened a while, probably a couple of weeks prior. But there was no mention of a potential cluster. What is the situation, if you know, what is the situation with that cluster and the contact tracing? Has that been going along, or, I'm kind of concerned because it did take a while for the public to find out.
We're concerned about it. As a private medical community, we're concerned about it because basically what happened was there was a positive, and it was 10 to 14 days later or so. Finally, then another few members of the person's family tested positive, and then another couple of people that were associated tested positive. And, the first thing I have to say is this goes right in the face of what we have been doing, testing privately, and has been done across the United States of America, which is you test asymptomatic family members and contacts. You do not just wait for the family members to get sick before you test them. And so here's a perfect example, because these people they waited till they developed symptoms, then basically they got the disease, and then they spread it to some other people because they waited to be tested. The bottom line is we have so much testing capability in this state that just sits unused every day. There is absolutely no reason why we are not very aggressively testing asymptomatic individuals that are associated with anyone that's been in contact with positives. And so that does concern us.
Well, if I guess the question that I have, Doc, and first of all, welcome back. Good to see you.
Thank you, Charlie. Thank you.
With a lot of people, because of frustration, right? We've been closed for a while, and they're finally getting back on their feet. So the question has always arisen from this whole pandemic was, either the virus is going to kill us, or the unemployment situation is our livelihood is going to get the best of us. Okay. So having known that, we have the ability to test, but one of the things that keeps popping up is the economic engine, which is the tourism. And it just doesn't seem like the state has a handle on how they'll handle the influx, because based on what you said, at zero, that means that we're pretty much scrubbed clean of this virus, right? It's not going to grow from within us. It's going to have to come from the outside again.
Exactly.
And that's where the danger, and I think some of the people that I get into a little debate with is I'm trying to tell them that, it can only come in two ways, either by water or by air. It's not going to come anywhere. And how would you address that as far as, opening up for tourism? What's your insight?
I have very strong feelings about this. And the bottom line is some comments that have been made by public officials are very concerning to me. These comments are, oh, it's inevitable. Oh, we're going to have more disease here. Oh, we have to be ready for all the next clusters and all the next outbreaks. And we have to be ready for, when it comes back in the winter. Well, not necessarily true. if we are working closely as a state to ensure that people coming into the state do not have infection, and we're watching our residents that may have to get back and maybe go to the mainland, and they're going to have to be checked and tested, and when they come back, we are not going to have a massive amount of disease that will spread through this state. So the discussion of this inevitability, like we're going to have, you know, the inevitability that more people have to die to open up our economy, I don't buy that. I don't see any public officials volunteering their kapuna to be the first ones to step into the line of fire. Wrong answer. We need to, first of all, no questions, test before people come into the island. And I think there have been proposals to test 3 days before you come in. I would think that that would be acceptable. And then if you really play it by a standard medical science that we know about the disease, you would then test. If someone's staying longer than a week, you would want to test them a second time about 5 to 7 days in. And that would be the first step that we would do. I just cannot imagine we are not going to proceed with requiring testing for someone to be let loose in our streets or into our, our communities if we care about our families. And then, I have a hard time to say, well, how are we going to balance that with quarantining? Well, we're going to quarantine 10,000 visitors. Come on, that's not going to happen. That's not the answer. We can't quarantine effectively 150 or 200 people. So, I think we're going to have to push hard to have something done that people, before they enter our state, similar to what Iceland is doing and some other countries are doing, they have to be tested to know they're disease-free.
So, say if we have that dilemma, it seems like a standoff, right? Because we know that if they ramp up to maybe not what they had before, but say between 15 to 20,000 coming into the state, I mean, that's a huge number to put into a facility, a quarantine facility.
Exactly.
And if we're not able to get that testing, what you've been talking about prior to getting on a plane to come here, what are the other options that we have that you know of? Or there is no other option?
There is no other option. I mean, when you look at the amount of disease that's on the mainland right now and across the world, I mean, it's just ramping up in certain areas in different parts of the globe. And if you just look across even the United States to one of the main areas, there is a lot of disease still present. I mean, and so to automatically assume that someone's going to come here and hope that they don't have the disease, we just can't do that. We are asking, one thing I know we all do not want is to have, first of all, anybody have to die from this any further. Second is to have to open up and shut down again. That would be an utter mistake beyond mistakes that is preventable. And so that can't be an option from my perspective. We have to do this one time and do it gradual, but do it the right way.
But that's the frustration, because we hear our leaders talking about testing and testing and testing. We have Congressman Case now trying to get testing before they come to Hawaii. A lot of talk, but no one's really moving that, put it into action. In the meantime, every day more visitors are showing up on the shores. More people we're finding more people getting out of quarantine, sneaking out, and we're arresting them at the airport on their way back. They were at the airport ready to catch their flight back to wherever the hell they came from. And now we're arresting him, but he spent his vacation here in Hawaii, possibly infecting some people. So, and we're talking only a few hundred. I mean, if you take out the crew, you talk about a few hundred, 400. What if we just get to 1,000 or 2,000 or 3,000? I know Charlie mentioned 10,000, but I'm talking about just, what if we just get 4 or 5 times more than we have right now? We're going to have 4 or 5 times more people escaping quarantine, running around, potentially infecting our people here. But we needed to do the testing before they got on a plane 2 weeks ago, a month ago. And
exactly.
I honestly don't see that happening in the near future. But that's not going to stop this state. We're going to move. We're moving, and we're going to be open up real soon. And I'm afraid that if we don't isolate or secure our airports, then we're going to be in trouble. We're going to be in trouble.
100% agree. I mean, we have had this pilot going on right now, which is, this quote unquote quarantine. And I think it's very clear it's not working. And to think that we're going to, like you, I totally agree with your numbers, 500, 1,000, 2,000. We're not going to be able to keep those people, especially look at what's going on now. We've also opened our state back up. So our people are back out. These people could blend right in. It's not going to be able to happen where we're going to be able to watch these individuals. We're going to have to insist on testing. Now I'm going to give you just a couple things. Like last week, I was asked to testify and present in front of the Honolulu City Council. And I've had a lot of private meetings with some council members. They are very interested to do anything possible to help increase the amount of testing that is available. I feel like over here in Honolulu City Council, they get it. They totally understand that testing is the only answer. I believe our mayor here on Oahu, Mayor Caldwell, feels pretty strongly about that. I've had just conversations just today with Mayor Kawakami, and I think he's protected your islands, or the island of Kauai, very well. And I know he feels strongly about very small incremental increases. Same thing, I was talked to Mayor Victorino probably 45 minutes ago, and we're going back over to Maui. So I'm in contact with all of the mayors, and I think they all share the concept of gradual, safe reopening, protecting the people that put them into office. Another point, so the city council here is looking to do anything they can to fund the testing. A lot of these counties, Mel and Charlie, are sitting on a lot of money that's got to be spent by the end of the year. And that's probably not a bad way to think about using some of that if they could facilitate ways to make it easy to test. And I will tell you what I also did today, just kind of taking this out on my own. I talked to the chief medical officer of Walgreens USA. Walgreens helped us with our first test when they allowed us to use Walgreens Kaneohe. And they were so interested in how popular our drive-through testing was that I developed the rapport, and they were sending reps, and they were contacting me at Walgreens to try to use our model across the country. And so I've maintained a relationship with Dr. Kevin Ban. And my idea was, let's develop a relationship with Walgreens and CVS. Let's have a high quality test that they do internally, that we work with our visitor industry, hotels, airlines, and have people across the country be able to go into the nearest Walgreens or CVS to have their testing done and to get their suntan lotion and snacks 3 days before they come. And I think that's a good option. So Walgreens is very interested in talking to our leadership a little more about something like that.
So to succeed in the testing program, if they come here, we test them. We would probably have to get a testing system that can rapidly give us results, correct?
Or yes. Yes, ideally. And the testing, which is high quality right now, that gives us results that we need to have that are reliable, is the testing we're doing, which is, the nasal swab, the nasopharyngeal swab. And that, we have, again, 3,000 to 4,000 tests we're doing here on the islands, but the short rapid tests, the ones that, take about 10 to 15 minutes, the main testing unit that just came online about a month ago, that we have about, I think, 16 units across the counties and the hospitals, it just got knocked out of the water to show it's only 80% accurate. And that just came out in the last 4 days. So we can't rely on 80% accuracy. This is our lives. These are the people and our families. This needs to be in the high 90%. And it has to be done by a quality lab with a quality specimen and a quality test that's reliable. We just can't take any chances. I just want all of your listeners and people that are watching this to understand, we cannot afford to go and get to a point where we have to shut down our state again. That would be devastating. We are a shining light, not only in the country, in the world right now. And, I want to throw out something that makes this something a highlight, because, I do all the science behind all this. You and Kauai are a good example of why you're so successful. I've studied this because my conversations with the mayor and with you guys that you guys helped stimulate is there a question where maybe Kauai isn't testing enough, and therefore that's why the numbers are so low? And I don't believe so. I just believe that what you all have is your visitor industry is relatively low density. And so think about Waikiki. When you get 25,000 workers and another 25,000 people or more, maybe 30,000 staying down there, and you have another 25, 30,000 residents that live in Waikiki, and you put all that in like less than a 3 square mile area, you have now density that exceeds Manhattan. That is, when we look at the studies that have come out on this, high density populations is where that's R0, the factor that shows how fast it spreads, goes through the ceiling. So the fact that we were able to keep our disease spread down here was remarkable for the rest of the country. It's pretty easy to do it in Montana or Wyoming, where there's, 30, 40 miles between a town of 40 people. But you guys on Kauai have a wonderful opportunity, because even though you have tourism, your tourism is not really heavily, densely in one area. It's spread out. And that is a wonderful opportunity why you in Kauai should be able to be having this disease at your beck and call. You should be able to keep it off your island and not have to worry about it if we do it right, because you have so many factors that are the right factors for not allowing this disease to spread. Oahu, obviously, we have a bigger problem here. Kona, a little more concentrated. Maui, like Lahaina, those areas, they have a little more issue. But you guys are the bomb. You guys could really, really conquer this.
So how do we go about, the movement of tourists come in? And like what you just said, how do we go about having them tested and not using the swabs? It probably takes 1 to 2 days or 3 days if we get a result.
12 hours if we do it the right way. For us to do this, we need to have that testing process just wired. And so the city council here asked me to reach out to diagnostics and clinical and to talk to them to say, what will it take for you guys to be able to get this high volume, high capacity testing of high accuracy that we can rely on, where, we can get people tested very rapidly. And so
are we looking at holding the people at the airport for the 12 hours until the test comes back?
That's the problem. That's why you do it. That's what you do at home, right? And before they arrive, that's why. And you're going to have some degree of high capacity testing, so that in case something goes wrong, that, you need to have the testing. But I mean, to have people queued up in a line at the airport, come on, man. We all know that's just not practical. It's just not practical. And, let me throw something out about that. I mean, there's been a lot of discussions about thermal screening and temperature checks. That's pretty low yield. You know what? If that cannot be the reliance, we cannot rely on that to protect our families. Yeah. Is it going to be nice if we're going to buy it and we're going to see if someone, lights up like a Christmas tree? Sure. Now what do you do with them? Right? What happens? All right, now we own them. They're here. They're already on the island. Now we take them over and we put them in some kind of medical facility. Then we got to get some kind of ambulance with people in PPE. And then we got to transfer them to one of our emergency rooms, and they've got to have PPE. And then they got to be put in there and they got to be tested. You can't just put that person back on the plane, right? And that goes the whole ways through about testing on the island. If we get someone positive, you got to go through that whole step. We get. What do we do with these people? we got to fill our hospitals up with them. So it's a problem.
Well, we saw what happened with the guy from Arkansas. He came in, he lit up the thermometer or whatever probe, and they let him go.
Unreal.
He went home. He went to his family and his friends. That's what happened. And we have no system. I mean, and what can you do with the guy? Like you said, he turns out he tested positive. Now they got to go try to find the people that were on that plane and find the people he came in contact with at the airport in Arkansas, in LA, and all the connecting airports. That's my point. It's once they're here, in a sense, it's too late.
Exactly.
It's too late. And
exactly.
But how do we get anybody that can make that decision understand that we are in a position where we can do this thing right and open up, but the fact that they're talking about it, that's not helping. I mean, we keep getting more visitors every single day, and there is no process. I mean, yeah, we lucked out with the guy. The guy didn't even know he had a fever. He didn't feel like he had a fever.
Right.
He felt fine, and he was at 101.4 or whatever it was. Oops. Okay, you just go on your way. They actually did the test, but they sent him home. And who knows how many people this guy came in contact with? And we if we're not doing the contact tracing properly, then we'll never know.
Well, and this also goes back to one of the things that I've been very public about, and that is just the ability. Well, okay, so look at this guy as a perfect example. If you would follow the guidelines that keep getting pushed here, that is, they would never tested him in the first place if they weren't checking a temperature, because he didn't have a cough, he didn't have any kind of symptoms. And here's the other data that's coming out. We know now that those 2 to 3 days before people are symptomatic, where they're really fulminant, is probably one of the most contagious times of this disease. So even 2 to 3 days before this guy was tested here, he was shedding this everywhere. And, so we have never once addressed in this state with any of our leadership. I wish somebody would look at the leadership when they're on all these fluffy little press conferences to say, okay, 40% of everybody with this disease is an asymptomatic positive. What have we done as a state to attempt to find and identify the people that are asymptomatic positives? The answer is nothing. Unless it was us, nothing was being done. We didn't stop. And I think I mentioned, well, no, maybe I didn't mention this because, like, for example, Mayor Victorino called us to go over after he had his big cluster over there. And he called me at 5:30 in the morning. I was over there at noon with a team of 25. We started testing for the next 2 or 3 days. They had 200 tests total done before we arrived. By the time we left, 2 teams in the next 9 days, we'd over 2,000 tests done. And I will never, ever forget this, that we opened the first morning to hospital workers, especially because the cluster was in the hospital. And so we were just testing because we knew where the people worked, and they knew where the people worked. So if you worked in the same department as that person, we tested you. If you were in close contact with that person, we were testing you. Now that's different than what our Department of Health still does. I then personally got all the phone calls for the positives because they were all entered under my name. The first 9 positives I had were all asymptomatic positives, and they were all coworkers within the same couple of places that these people were clustered. And I talked to these people, and 2 of them were like, oh yeah. And after I worked there, I went up to Kula, and there's 120 long-term skilled nursing people, and I worked with them for 2 days. And yeah, and then I was down at this skilled nursing facility, working in this skilled nursing facility. And I was like, oh my God, this is just the biggest nightmare that we could ever ask for. But fortunately, we got there soon enough, and we were aggressively screening. And that's how we blew open that whole cluster by testing for asymptomatics as well as people who were symptomatic. And you got to just test.
Hang on, I got a question. We have an issue with, for some reason, the what is considered essential workers that can travel between islands, in essence, with no quarantine. You know, they're allowed to go from their work. In fact, if you read the proclamation, they can go to their job. If they're staying overnight on another island, they can go to the job site and they can stop to pick up essentials, whether food or whatever, and then head over to the hotel and then come back in the morning. And or those that are flying back and forth on the same, you know, on the same day, not staying overnight. But do you think it would be wise to test these people that are going from Honolulu to Kauai or Maui to Honolulu? Or you think that it's, what's your take on this? That I mean, what to me, what the virus doesn't know if you're a visitor or a resident. The virus doesn't know. It doesn't matter. It's non-discriminatory. It's if you're a host and you come in contact with a carrier, there's a chance you're going to catch it. So what's your position on these guys that are flying back and forth between islands and no one's really checking?
I would have said 3-4 weeks ago, I would have answered your question, yes. But at this stage, I would say not a problem because of the low prevalence and the low viral load we have in our state right now. So at this stage, I'm actually the other direction on this, Mel. I think we're getting to the point now where I do believe as we open our combined economy, that we should be considering allowing inter-island travel for our residents. You know, here, one of my beliefs is this. When you start talking about opening up our economy, so I'm in agreement with a lot of what we're doing right now, where we're starting to expand a lot of the outdoor activities and the beaches, and with the malls with capacity control, things like that. And I'm very much at this stage thinking one of the next steps will be in neighbor island travel. I think people want to go see their families and things, and still try to maintain the social distances, wear masks. Think about it. That's how we're going to prove, are we okay to keep expanding? We do not want to go from where we are now and all of a sudden have, 350 people 10 days or 10 times every day jumping off a plane from LA, New York, Seattle, or Asia. We can't do that, even a small amount of people. Let's see if we're able to control things internally and start moving our residents, especially families. There's no reason that very shortly now the families shouldn't be able to start going to see their loved ones on the neighbor islands. So the workers now, since there's a low viral load, I'm not that concerned about.
I think I agree with you, and like I said, many of the people I've said this to. This state really got scrubbed clean. We got scrubbed to the bone. But there shouldn't be anything popping up. But I go back to that, when they come from the outside, I really would like to explore how can we get them tested over there before they jump on a plane. Because once they, it's like a burglar, right? If you got a burglar cornered in a building, you know where he's at. But then at the same token, if you don't know where he's at, and you hear a couple of shots coming from far distance, that thing can be anywhere. And that's the thing that I get worried about, is that when we start having those outside travelers, and it can be residents returning home, because they can be a carrier bringing it back. Because what it's going to do, because we still have not mastered the art of contact tracing. We haven't mastered it. So, and right now, as small as it is, we have travelers going to Maui and they're eluding the system. So that's being proven right now. So if anything this pandemic did for the state of Hawaii was it exposed our vulnerability, that if somebody wanted to do a biological warfare on us, we laid the template out. We showed them where our weaknesses were. So
got my barking dog in the background. I don't know if you can hear my hounds out there barking at something. So
the burglar that Charlie was just talking about. You gotta watch out.
The burglar out there. I don't know what he's barking about. So, and my family's in there, just kind of sitting there gradually. I think there's a little TV and there's a little bit of watching some reading books going on in there. So, don't they know that their dog's interrupting the Mel and Charlie and this Facebook? I don't get it, man. So,
just tagging on to what Charlie was saying, and I keep thinking about Korea, who had an amazing system going down. They didn't have to shut anything down, and then and they had patient 31, but then it just went south again because one guy comes in, goes to a nightclub, and that nightclub could be a plane. That nightclub could be a plane. It could be and like that guy from Arkansas. That nightclub could be a friend of mine who's actually on this. She flying back from Honolulu, and some guy sits next to her. I don't know why. The plane is empty, and these flight attendants apparently aren't enforcing the social distancing rule. But my point is that this contact, when you have this bunch of unknown people coming in, can go bad, and that's what I'm afraid of. And because of our culture, because of our the more and more we get with these low numbers, we get more complacent. Just look at the beaches, look at the roads now. It's like we're back to where we were. And so again, it's not going to take much. It's not going to take much to trigger an outbreak or a cluster. By the way, that same girl asked if she went to Honolulu for some medical appointment, is there any way she could sneak out and find you somewhere to get tested? Because her doctor's not letting her get tested over here.
Absolutely. She can just look up under my name and we'll get her over to one of my facilities. We'll bring her over. Absolutely. Yeah. No question about it. Yeah.
I keep hearing this, that, you still require a few symptoms to get tested over here. And that's still a bug. That bugs me to no end. It really does.
We're using 300, 400 tests a day, likely right now. We have 3,000 tests a day that we could do, 3,500, 4,000 tests. So, yeah, I mean, there you guys have it.
This is Kauai's numbers, 1775 total since the beginning of COVID. 1775. That's what we've done.
Wow.
That's the total. This is from the state's website. This isn't my numbers. I didn't create this chart. And this is this is updated today. That's our numbers for Kauai, sir. And that's what I'm saying.
Wow. That is just incredible. Again, yeah. But I mean, I think Kauai is in a great position. I am very happy with the mayor, what he's done. And I think a lot of what's happened right now is, like I said, I've really studied the science of why this is probably like it's been. And if you look at where the positives are, et cetera, and I think that density is a big issue. I think that, the island of Kauai, the mayor has been very aggressive with enforcement, and I think the people have been compliant. I mean, it's real. I believe the low numbers are very, very real, and it's just a blessing. It is a blessing that of all the islands, I mean, maybe you guys in Molokai and maybe Lanai right now are in those positions where if we do the right thing, we should be able to keep you with zeros in your disease if we do the right thing. And so I think the numbers are real. I think here on Oahu, I still have issues, with how large our island is. And, we're trying to work with doing some of the public housing. And, I think a lot of those people were afraid to get tested. So we actually had a proposal went into the mayor over here to do more broad scale public housing, following the guidelines that the United States is presenting, where you do full testing, whether it's a homeless shelter, public housing, cluster outbreaks, you test everyone. You do not wait till they have symptoms or just selectively go and ask people. You ask all of them to be tested. It's America. We can't force them, but we need to make this testing broadly available to especially high-risk areas. Another area is like group homes, like over here, and I'm sure you guys have them there, where you have people that are in either substance abuse or, a clean and sober or partial, disability, et cetera. And they're two people in a bunk bed and there's 3 bunk beds in a room. Those are very high risk facilities. We need to be aggressively testing those places and continuing to aggressively test them.
Doctor, when you meet with these officials, like back in Honolulu, do they ask you the question of what will it take or how can we approach getting testing done before they reach the Hawaiian Islands? Do they ask you for your expertise on that and try to see, maybe make recommendations on how we can get? Because I think what you're talking about, the only way we're going to get it done is they got to get tested there. They have to get tested there, especially if you're talking about the travel load that they're talking about. Because, ramping up to 30, 40,000 a day, whew, I mean, we'll get nailed. We'll get nailed.
The city council has asked me here, and I've talked to Mayor Victorino's team. We've engaged them, but I think that there are definitely discussions at those levels, and I'm hoping our legislature will be actively involved with this. I really, have a lot of faith in some of our legislators that they're going to stand up and do what's right. And so, yes, there have been people that have been engaging the discussions, but what's missing from my standpoint is the commitment and drive to stand up and say, listen, until you find a solution for this, it's not happening. So you better start working on finding a solution that you work with everyone on. And, I'm not saying we're the end all do all, but it is a free for all out there with the type of testing that's available. We need a valid test. So when someone shows up, that it's something that I would feel good about putting my family, even my barking dog out there. If I would put my family and my relatives and my close friends in the same room as those people, because I really feel like that was an accurate test. Now, I'm going to qualify. Nothing's 100%. We all know that. We all know this world, but there is data available to know that if we use the proper testing instrument that's performed the proper way, we're going to have a really, really, really high estimate in the high 90s that this person is coming in asymptomatic and is not carrying disease. And is not going to spread COVID. And then if they're staying if they get it 3 days before, about a week later, I want a second test. And I've started to bring that up, and I've just seen people roll their eyes and say, oh, that's never going to happen. What do you mean? We can't ask a tourist to get tested twice while they're here. Well, then we're going to be talking that this person could have been just beginning of their symptoms or pre-symptomatic, and they're going to come here, and then they're going to start actively displaying the disease. Because remember, the prime incubation period after contact is 5 to 7 days. And if that person just contacted the disease the day they were getting tested 3 days before, they may not show. But, when they're here about 4 or 5 days, a week in, they're going to start showing symptoms and they're going to be able to test positive. So, if people are willing to stay here longer, I think a test would be beneficial. Now, let me say something I think both of you guys will get. And I had this conversation with today. I had it today with Dr. Ban. This is the chief medical officer for Walgreens, and he's over in the East Coast. He's like suburban, I think New York or something like that. And I started to tell him, we had a nice conversation about where our disease burden is, et cetera. And I was explaining how we want to get the testing done before. And you know what he said to me? He said, God, I can't wait till you guys open. I want to bring my family to Hawaii on vacation. Okay. Here is a bright medical person. And he's like, we're dying. He said that people are dying to go somewhere. Everybody are so locked up. They want to go somewhere. Now think about it. if we can make Hawaii and Kauai specifically the place where, as a tourist, you can go and feel like you can finally let your guard down, and you can go somewhere where the risk of COVID has been almost completely taken away, we are going to be a place that will be of the envy of the world. So we need to think about that. You know, we need to not think about just flipping the switch off. We need to make ourselves the place where I think people will go that extra yard to get that test, knowing that they're contributing to one of the safest places on the planet to be able to come and vacation with peace. So, I mean, I want to start hearing that discussion going on in this state right now. And it protects all of us.
I think right now, you said something earlier, and we've been seeing this along the way with the upper administration. And, you know, Mel and I have been sounding the alarm, and that is, you know, when you're in a position to make a decision and pull the trigger on it, like what you said, to protect the people of this our community here in the islands, right? To get the testing, it's just, we don't know if anybody has the intestinal fortitude. This is okay. We're going to make that decision. We're going to push legislation, and we're going to push it hard, because that's the only way. Because right now, I don't see anybody volunteering to want to go and spend a week in New York. Do you know anybody that right now wants to go to New York?
Exactly. Or Vegas, or LA, or Seattle, or anywhere for that matter, you know. And yet, you're right. You are exactly right. We have a great opportunity. So, yeah. What about the leadership you guys have interviewed? Have you had anybody, because I know you have some great guests. Does anybody, you know, seem to volunteer to, you know, to really want to guarantee to push that testing must be done, or is everybody just kind of him-hawing and beating around the bush on it?
Well, Mel, why don't you, I think the LG, right? The LG was one of those that really brought it forward the first go around.
Yeah, you know? I mean, he'll be on tomorrow night. Lieutenant Governor Josh will be on tomorrow night. I haven't spoken to him. I mean, you know, he's kind of on the governor's wagon to open up the state, you know, and you know, I understand that a lot of people want to do that. As far as the Senate leadership, House leadership, they share the concern that we do, is that until we secure our airports, until we secure and ensure that these guys coming from everywhere else are safe, then we're not ready. And but again, you know, what can we do? What can the legislators do except keep bringing it up with the administration? I mean, like I said, Congressman Case is trying to get some kind of federal regulation in place, but these things take time. But as far as just here in Hawaii, you know what, my concern is that the administration is satisfied with this crappy system that we have right now, and they're willing to take a chance. And I've heard them say, you know, their focus is preparing for the worst case scenario, making sure that we can, what term do they use, surge up and have more beds and ventilators. That is what I'm seeing, versus having the discussion on securing that damn airport. That is my frustration. And if you cannot get them coming in, I know there's Rich Robinson who's on this call. You know, he came up with a plan where if you cannot get them tested before they get on the plane, once they hit the county property, once they drive off that damn state airport property, you have a tent set up right there and you test them. And if they're positive, and yeah, if it takes 24 hours or 48 hours, unfortunately, they're going to have to go quarantine until you get the result. But the way it's working right now, where people coming in, they're lying about their place of accommodation. They're not testing. They're not tested. They get a temporal scan, and you know, that's pathetic. That's really pathetic. But that's what we have. And as I see the administration, our state administration, they're okay with that, and they're okay that it's not perfect. They're okay that we see them here on Kauai. They lie. You know, the one in Honolulu, the guy was in a B&B, is an Airbnb. That's illegal right now. But nothing's done. You know, he whatever. Anyway, So
Well,
as far as your question, as far as the state leadership, everyone's trying to make sure that these guys are virus free before they get here. I mean, that's the hope. But in all reality, you know, and I've been in government for a long time, something of that magnitude is going to take a while. It's going to take a while. But as we open the state, I can tell you within the next 2 weeks to a month, we're going to see 1,000, 1,500 visitors coming in a day. And how we're going to manage that? We cannot manage 200 and 300. And that's my biggest fear. And understand we all want to open up, but I'm afraid for my mother-in-law who's 82 years old.
exactly.
We're going to open them up and everybody's going to feel comfortable. They're going to go to the hairdresser. They're going to the barbershop. Visitors are going to come get their hair cut because their barbers and beauticians and wherever the hell they came from is not open. So they're going to come here and get it done. That's my fear, Doc. That's my fear.
Well, listen to what you just said. I mean, that's exactly my fear. It's exactly, listen to what you just said. And I agree. I've heard these people say, and I just want to jump out of my chair. Oh, we're going to be prepared for the surge, and we have to make sure we have really aggressive contact tracing, and we have a lot of ventilators. And that means we've already let too much disease into our island to affect our populations and to kill our family and to make a difference where if we have to start talking about being so concerned about surge, we have failed miserably. We have failed our people of our state miserably. For us to go from having perfect, almost perfect, no disease presence to then turn back and say, okay, all the disease comes in, we're not going to test you, or we're not going to pay attention, we'll turn our head the other way. That's the lives of our family. I just can't listen to that. And, you know, I have another point. I've had more than one occasion where I've sat in some meetings with General O'Hara, nice guy, well-trained, nothing but respect. And, you know, I heard his comment last week, and, you know, I've heard those comments before about, you know, that's what he's trained at as a military leader, to say, what's the worst case scenario? His whole training has been about preparing for the worst case scenario. So do we need that? Yes, that's, you know, that the same playbook is written in our country. If we get attacked or we're at war or there's chemical warfare, there's a million different things that could shut off our food supply or things like that. But where I differ with the general is knowing what's right here and knowing the heart of the people. And for our people to go from where they are to go to violence and to be in the streets, that's not Hawaii. That's not the people. That's not the place we all, you know, have grown in and love. I mean, I believe that the people would protest their leadership well before they would ever become violent, to say we need some people that are going to take our interest in mind and listen to what needs to be done. So I feel good that the people of Hawaii are not ready to be violent in the streets. I think they will be patient, more patient than we give them credit for with economic downturn, just to know that there is a light at the end of the tunnel for safety. But I feel strongly about that, knowing the hearts and souls of our population. I don't know what you guys think about that.
No, I agree. I think, you know, when you're preparing for the surge, that's kind of like you've conceded that based on the plan of action that you're taking, you're gonna get some collateral damage, and that's okay. That's honestly that, and I don't think that's acceptable.
Neither do I.
I mean, I understand there's a lot of people that want to get back to work and so forth, and I do. I want to see that. I want to see everybody open, but I haven't heard anyway from our state leaders at the administration any strong push to the federal government to require this testing before you board a plane. I just haven't heard it, and I think that's where the emphasis got to be placed. I think it's got to be a unified front from all the state legislature, starting at the governor, state legislature, all the mayors and all the councils, everybody come together and say, this is what we need. Kauai and Hawaii is a very delicate ecosystem that we need to protect. I just haven't heard that. What I heard was we feel real comfortable that should we need to surge, we'll be able to handle that. We'll be able to surge up the ventilators. I mean, no, man, no.
Too late.
Let's not have to use them.
Totally agree. Totally agree.
Doc, you know when someone is contagious or asymptomatic, I should say,
right,
and they're able to infect others, how much does it really take? I know it depends on the person who's going to be the receiving end, whether the immune system is low or not, or if they have enough will, I guess, to outlast the thing, right? But how much does it take to infect another person? Does it take much, or just a little?
You are correct. It does depend on your immune system and where the virus goes. I mean, there's reports that it can be obviously from your nose, from your mouth. There's even reports that people with the secretions in the eye can have it absorbed in. So it doesn't take a lot. There's a couple interesting things. The studies that are coming out are very interesting. And one that I would highlight is, and this is good for the public to know, is they rated the masks, and it goes from you taking a cotton t-shirt to using a low-grade surgical mask to using kind of the nylon ones that are being created, the whole ways up to the N95. And they rated the percentage of the virus that can actually be emitted. Because remember, unless it's a medical grade mask, you can still have virus being emitted. And it's a little bit scary. It is scary how much virus still comes out of just the masks that we're wearing in the public right now. And so I agree with masks. I'm 100% solid that they need to be done, but they should also not give us a false sense of security, right? And then you combine that with another study, which is the difference between external outdoor environments and indoor environments. A couple of the studies have just come out, have shown that there's such low transmission outside. That's why I'm totally happy with opening our beaches and things. I'm totally open before we move into any big closed restaurants where we start having kind of the European outdoor. Let's set tables up everywhere. Let's loosen our laws to let the restaurants be, finding every little puka and corner they can in their parking lot or whatever to set up tables, and then spread them out. That would be fabulous for restaurants before we go internal. And then, there are more data and studies that come out about the number of droplets that come out of your mouth just by talking, versus number one, sneeze. Oh, sneeze is like the atom bomb going off. The rate of the projectile of those droplets and how high they go and how many heavy ones and light ones. Man, oh man, sneezing is really tough. And then of course, coughing is after that. But, there's so much data we're learning about this from a medical perspective that needs to be kind of put into play when we make some of these decisions of what can open and what cannot open. But for all the viewers out there, inside versus outside is very concerning to me. And another thing I was asked on another interview I was on last week was airplanes. Are airplanes safe? No way, man. I wouldn't be flying from the mainland with just a little surgical mask or just like my shirt pulled up over your nose. I mean, you're 5 hours sitting in that closed circulation. No, boy, you want to know those people were tested and negative before you get on that plane.
Okay. Well,
and that's why I and again, you there, Scott?
Yeah.
Okay. I know that when you look at the numbers, the daily flights and the increasing numbers, there's still a lot of returning residents coming back as well. Returning from where, I don't know. I'm not sure how many of those returning residents are going away for recreation or pleasure versus business. Like I said, it doesn't matter if you're living in Arkansas or you're living on Kauai, coming back from the mainland after visiting family or friends. I mean, you're still vulnerable to get this thing. And especially after spending 6 hours, or in the case of a guy from Arkansas, he probably spent at least 10 hours in the air.
Sure.
And he was positive. So, it's scary. It's scary.
I was reading these numbers, and like you said, Doc, one thing that kind of amazed me was, like you said, outside versus inside. And then the other thing that amazed me was the amount of exposure. How much time you spend next to someone and get exposed. The longer you stay there, it's just that much more can get dumped on you if you're not careful. So I think, you know, I tell my family, hey, say hi, bye, and just move. Just keep on moving. Don't stay around too long.
Yeah. I always, you know, when I'm asked about this, use fans, use the trade winds, use ventilation. You know, I think that those discussions have to be made when we talk about whether it's workplaces or restaurants or hotels, or, you know, there's so many nuances and specifics that can be implemented to make things a lot safer. So I believe there are a lot of options we can start creating. Actually, I've been called by, my gosh, hotels. I was just called by the film industry. I mean, I'm being called to give advice, schools, daycares. I mean, I'm getting called by everybody to ask for advice on safety. So it's good. People are listening. People are trying to do the right thing. I totally believe that.
Well, you know,
I think Kauai's in a good place. I think, you know, I know Derek did talk to you about the testing, and you know, since the state has relaxed the requirements, still I still think it's still too strict, but nonetheless, we have, when you look at the numbers daily, after the state relaxed the requirements or the symptoms required, I think we're up to about 40 or 50 tests a day, compared to the 8 to 12 tests a day that we were having. So, you know, it has helped. And I think, like Charlie keeps using the term, scrubbed. This island has pretty much scrubbed the virus. You know, my fear is that when you look at these people coming in, it'll just take one to really disrupt what's all the good that we've done, just to, you know, if imagine what would happen. And I haven't heard any officials say at what point do we revert back to square one. Is it what, 10 cases? Is it 20 cases? Is it 100 cases? And that's, I don't see that. I'm not sure if they even have that number prepared or figured out, but we'll see. I guess we just got to wait and see.
The problem with that is by the time you get the cases, and they get the whole ways up, because the Department of Health, the cases we're getting, you know, reported by them are usually a day or two recorded before. And by the time a patient gets identified, and by the time it goes to the lab, it's a lag. So there is a lag. So that's the other question. If we're waiting by the time there is 10, then that means there's already a queue of another 20 or 40 that are yet to be identified and put into that group. So that's a dangerous way to look at it. But I mean, there has to be some number that we use to identify it. But I agree. I'm just concerned that there's just not a lot of defined information for us to understand what it's going to take to open up by any means. Oh, hey, I forgot. I wanted to tell you again. I think we're going to be over there. It looks like we're working closely with the mayor's team to possibly set up some antibody testing. So we had some conversations today, and then we exchanged some information. And it seems like he and his team it's not confirmed, but we're exploring very much the antibody testing. And are you guys familiar with the antibody testing and what that is and what we're trying to accomplish with that?
I mean, what we've heard on the news and what we've read. Maybe Charlie, okay. I'm not sure. Well, I tell you what, when you get that confirmed up, let me know, and we'll get you back on to share. That's exciting news. I got to tell you, it's exciting news. I'm not sure what the requirements to get antibody testing is. I mean, you gotta have died.
Can I? No. Can I? I'll just give you, because I'm looking. I'm just like, oh my God, the hour's going fast. Once again,
it went by so quick. I know it went by so quick.
This is the fastest hour of my life. Every time I'm on with you guys, jeez. And I can't wait for the music. So So antibody testing, the people we're going to target, anybody who is COVID positive or any of their family members or close contacts that lived in the same household. Number two is first responders and healthcare workers. Number three is high contact tourism. Anybody who was working before we went social distancing and masks, when we still had all the planes and tourists coming in, we want to see if any of those people had asymptomatic positive disease. And number four are the individuals who basically had that wicked cough and fever and were wheezing and chest heavy between January, February, March, and even into April that never got tested because there was a bad something going around that a lot of us are wanting to check and believe that there could have been some early introduction and that we just didn't have testing or weren't even considering it then. So we have a lot of people coming up to get it. We've done about 400 or so on the Big Island. We did this weekend about another 200 or so and over on Oahu. So we've started the antibody testing. And just so everybody understands, it's a blood draw. So this is not a finger poke. This is very accurate, and it's a blood draw. And a lot of the insurances are covering it. Some are not covering it. And it's $40 for the test. And so therefore, since if you're paying for it as a consumer, then there is no restriction on, an act of Congress or, a decree from God to let you have it done. So it can be done for anybody. And remember, it would be 2 weeks after you have contacted the disease, you will guaranteed be showing or not showing antibodies. So it's going to be for a little bit of past exposure to see if you've been in contact with it.
Perfect.
That's a lot of good. Excited people on the call. A lot of excited people on the call. Thank you very much.
To spend $40, Doc, I think that's a drop in a bucket to know if you've been exposed or not. I mean, that
absolutely.
At least for us who the mystery has always been speculating, right?
That's right.
What's going on out there? Now you're gonna get to know if you and especially if you had what was one of those that had that nagging cough that you just couldn't get rid of, and you just said, something's just not right. At least you can put that to rest and see, hey, maybe you had it.
Or if you were around people that you thought were positive or were positive, yet the powers that be were saying, no, you don't get a test because you weren't coughing, or no, even though you're sleeping in the same bed as the person positive, no, you're not symptomatic, so therefore you're going to test it. No way. Everybody in the family needs to be tested if you were around closely a positive. So, and any contact should be tested.
Perfect. Good.
All you hotel managers and owners and all your GMs and all of that, get your employees, and the hotel should pay $40. I'd pay for my employees if I had any. I'll pay for my wife to get hers.
I just paid for all of my employees to get it.
But I'm afraid of needles, so.
You know what I'll do? I'll call a friend that's with the Hotel Workers Union. See if that's like a benefit program the union would do for its employees. Because I think it'll be a benefit to them if all the employees get tested,
Sure.
Yes.
I'm working closely with Eric Gill up at Local 5. If you look, Eric had me, we designed a program for the safety of all the Local 5 hotel workers. So you can go online and find that. I'm working really closely, and I really have a lot of respect for Eric, man. He really cares about his people. And so I've had more than, I've had at least 5, 6 really good sit downs and meetings. And you can see my name is on the safety for hotel workers. So yeah.
Yeah, I'm glad you put a plug, because my sister-in-law sits right next to him in that office.
Yeah.
I was asked her, I says, hey, but I know they take care of their employees very, very well. I'm sorry, their members take care of their members very well. Good.
Yeah.
I'm smiling because somebody just posted in the comments, what kind of dog do you have?
I've got a couple of them out there. We've always had golden retrievers, and then I'm actually known as the dog doctor, because when you come to my office, you're always greeted by dogs. I believe dogs rule the world. I was raised by dogs, and But my
He was
Goldens
raised by dogs.
raised by dogs in a pack underneath the house. Yeah, I didn't have a family or parents. It was dogs. Yeah, so I'm part dog, and so yeah. But my Goldens both got cancer about the last year and a half, and they had to be put down. And so my wife insisted, and the kids, we went with doodles. So they got a little bit of poodle, and they have golden retriever. And I wanted a bigger dog. So my dog's a Bernese Doodle. So he's a Bernese mountain dog, which is kind of a little step below St. Bernard mixed with poodle. So he's kind of a big, lovable, clumsy hound. So that's who was barking, my Bernese Doodle.
They heard you have show dogs. Are they show dogs?
My golden retrievers were show dogs. They were show dogs, and they were champions, but unfortunately both of them have died. So yeah, the Goldens have ribbons and everything like that. I never showed them or anything. They just were my buddies and my office dogs, but my wife's friends decided they wanted to show the dogs. So they were just wonderful comfort to the patients. Every single day you were greeted by a dog in my office. So that's kind of who I am.
All right. Well, Doc, it's about 8:12. Thank you for sharing your hour and 15 minutes with us. We will have the Lieutenant Governor on tomorrow night. I'm excited for that as well. But really, when you shore up the plans on the antibody testing, please let me know. We'll get you back on. Let me know as soon as you can, and we'll get you on. Hopefully it's soon, real soon, because I think a lot of the people here want to go get that test.
Yeah, I think it would be quite soon. So I'm expecting we'll work on something. And again, I have a lot of respect for your leadership there and the mayor, and it's his call finally to make that decision. But we're willing to do it anytime. And he and I have kept in contact since, I think you guys helped set up the discussions over the last month or more. And he knows that we're on hold for anything that would happen. And he was always contacting me to know that just being assured that if they had any positives or outbreaks, we would come over in a second. We'd be there for you guys.
He was on our show right after you and made that statement that you were in communication, and that in fact, when we got to that point, we needed more testing, that you would be summoned. So I'm excited for that.
Happy to do it.
I'm excited for that. Just a couple of announcements before we we sing our song. Gosh, we didn't sing our song 2 nights in a row. We got a lot of flack. A lot of you are asking about our shirts. If you already ordered a shirt, you don't have to worry about it. We'll get that to you in the next week or so. Kirk got bombarded with orders in the last couple of days, but we are no longer taking orders. But we are going to. I'll put up the link right after we get offline tonight, and you can go to the website and order them online. Same price, no changes. In fact, there's different colors available now. Kirk is gonna be taking over the shirt orders, so he's gonna make it available in different colors: white, red, black, forest green, navy blue, and gray. So I'll post the link up tonight right after we're done, and you can go place your orders there. For those of you, like I said, that already ordered, don't worry about it. We will get to you shortly. All right, Charles.
Well, I first would like to say thank you so much, Doc. It's always a pleasure having you on, learn new things. For our viewers out there, you heard it first again from Dr. Miscovich, that the key to the success of reopening our state has to be the testing, preferably before the traveler gets on the plane, before they get here. Because if they get here and we have, that's the last step of defense that we can put in, because once it passes the airport, we're vulnerable. So, we make sure that we reach all of you. So if you have any say with your representative, with your senator in your district, let them know. You heard it first from Dr. Miscovich, and what we've been pounding all along. We've scrubbed this state clean. We want to stay clean. The only way it's going to get infected, it's going to come back from the outside in. It's not going to grow in our state, okay? So just remember that. And I thank you again, Doc. And you're welcome anytime to join us, Doc. You're welcome anytime.
Anytime, guys. I tune in and listen too. So and I watch. So I'll be continuing. I'll be there tomorrow with Josh.
All right. It'll be fun. All right, Charles, take it away, buddy.
Hi.
All right, come on, Charles. They want us to go longer. Hey, everybody. Thank you, guys. Tomorrow night, 7 o'clock, Lieutenant Governor Josh Green. Gonna be an exciting time, I think. And Wednesday, we got some financial advice for you guys on Wednesday. Thursday, we got some kids coming on. We're gonna have some fun with some kids, youth media people. It'll be fun. All righty, we'll see you guys tomorrow night. Love you guys. God bless. Take care.
Aloha.
Aloha. See you guys.